Welcome, friends. Today is episode 10 of Keep Evolving. Keep Evolving is a program that aims to encourage families to keep celebrating family and having intentional family discussions. In our discussion today, we'll be looking at mental health with a bias toward the COVID-19, because that's a global situation that is facing the current world. So with me is Wendy Akinyi, and our special guest today is Dr. John Gatere, a psychiatrist. Welcome, Dr.
Thank you, Jackie. Thank you, Wendy.
So maybe before we start, I'll ask Dr. to briefly tell us what's about himself and possibly what psychiatry is all about.
Okay. My name is, as you mentioned, my name is Dr. John Gatere. I work as a consultant psychiatrist with the Ministry of Health. I'm mainly based at Mathare Hospital, but I also do a lot of private practice in hospitals here in Nairobi. It's a pleasure to be with you in this program today.
Thank you, Dr. So as we start off, Dr., you could possibly let us know a little bit about your job, that is being a psychiatrist, what it is like, and possibly mention some of the issues that are related to psychiatry.
Okay. Psychiatry is the study of mental disorders and their treatment. And for one to be a psychiatrist, first of all, you have to be a medical doctor. You must get a degree in medicine, become a general doctor, after which you go for 3 to 4 years as a resident, and you specialize in psychiatry. So the work of a psychiatrist is to make the diagnosis and treatment for mental disorders. This is as opposed to psychology, whereby psychology is a scientific study of the mind and its behaviors. And we work hand in hand with psychologists. While psychiatrists take the medical aspect of it and prescribe medications for mental disorders, psychologists take, they handle they offer what we call as psychotherapy. That is a talk therapy. Yes.
Wow. Thank you, Dr. And now that you want to look at mental health in relation to COVID, perhaps we can dive in, and we want to start by asking you to tell us more about COVID, and from there you can tell us some of the challenges that are arising as a result of COVID and that are related to the issues of mental health.
Okay, I think now anybody in this country, and maybe all over the world, most people are aware what is COVID, because it has been the main news item since the beginning of this year. Well, COVID refers to the illness you get as a result of infection by the coronavirus. And the coronavirus, as we are aware, came to the scene in a city in China called Wuhan in 2019, from where it has spread to all areas of the world. Today, all countries of the world, they are affected by COVID. So COVID is the illness which is triggered by the coronavirus.
Okay.
Yes.
So what are some of the challenges that are related to mental health that have arisen as a result of COVID-19?
Well, because of the nature of the transmission, we know that this infection is very easily transmittable, and it is transmittable through droplets, through contact. It has created a lot of fear. All of us are worried that we can get infected. It is not like the other diseases like HIV, whereby, if you do some certain things, you can get infected. But in the case of COVID, all of us can be victims because of the mode of transmission. And because of that mode of transmission, it is very easily transmitted. We are told that one person is able to infect 4 others. 4 others are going to infect another 4 others. So within a very short time, you can find the entire population is getting affected. So because of this fear of transmission, most of us have developed fear because we can become victims. And because of the government measures which have been put into place, whereby countries have been locked down, whereby people have been prevented from going to their usual places of work, this illness has made people stay at home. I remember since I was employed for many years, I've never taken leave. But the coronavirus made me to stay at home. And I can tell you that for somebody who has not been able, who is not used to staying at home, and now you are forced to stay indoors, it has created a lot of issues. There is that boredom.
Yeah.
You are used to waking up, going for work, even missing lunch, rushing here and there in Nairobi. Yeah. Now you've been told by the government there's no getting out of home. You are going to stay at home. So that issue, that change of status from somebody who was very busy and now you become idle, it has triggered a lot of issues.
Okay. That's true.
There is idleness. With idleness, the mind is idle. Most people are getting tired. Staying idle in the house is creating a lot of tiredness.
Exactly.
Some people are sleeping the whole day and night. So you find that at night they are having episodes where they are not getting sleep. And because of all these issues, some people are trying to spend time in the negative way. We know that the government has been arresting people because maybe some guys are going to the bars to drink against the government regulations. You have heard of the Kahawa special whereby some guys, to break the rules, they are going to the bar asking for 1 sausage and 2 beers to beat time. So because of all these issues, the change of status, some of us, all this is a stress.
Yeah.
It is a stress. And because of this stress, some people are going to get depression. Okay. And some other people, they are getting anxious. Am I going to lose my job? Am I going to be sacked? My business, is it going to succeed or not? Other people, because other people who have got chronic illnesses like diabetes and hypertension, they are not able to reach their doctors.
Exactly. That's true.
So you find that some of these chronic diseases, where people they are not able to meet their doctors, they are getting sick again. They are not able to control their diabetes. They are not able to control the hypertension and so forth. So it is creating all these issues. People with mental illnesses who need constant supply of drugs, they are getting relapses.
That's true.
So the consequences of COVID to the mental health issue is big and wide.
Wow. So we are facing a lot of negativity. That's quite clear. And maybe just as a question, how can you advise people to cope through this time? What mechanisms can they apply so that they're able to cope? And any preventive measures that can be applied as well, so that if you're doing well, you don't get to the point where you're breaking up?
As I've mentioned, COVID is a stressor. And it's not just a stressor, it is a major stressor. What is a stress? We say somebody is going through stress when they are facing major mental or emotional issues because of maybe of an uncertain future. All of us, we go through stress.
Exactly.
And all of us, and stress is normal. It's a normal reaction. All of us have sat for exams, and we are always anxious what the results will be, isn't it? All of us, we get sick. And when we are going to the hospital, we are wondering, what will the doctor say? Could I be having cancer? All of us have got relatives who are sick. When they are going to the hospital, what is going to happen? There is an uncertain future. Am I going to lose my job and so forth? All this is anxiety. And we say a little anxiety is good because it helps you to make decisions, to make corrective measures. Like if you're fearing to fail exams, you work hard so that you pass the exams.
Exactly.
And that way you avoid anxiety. But when this anxiety is prolonged and you are not getting a solution, that is when we say the anxiety is pathological and is likely to cause issues in your health. So some of this, most the way God has made our bodies, most of us are not going to get anxious. Because the mechanisms God has put into place, we are able to overcome the challenges. Out of people who experience anxious conditions like illnesses, financial strain, loss of a job, most of them will be able to cope. It's only a very small percentage of maybe 5% who are going to get mental health conditions like anxiety and depression.
Exactly.
So when you get a stress, how do you handle it? We have got what we call as positive coping mechanism and also negative coping mechanisms. In my area, I usually like dealing with the ladies because ladies know how to cope with with the stressful issues compared with the men. Because in most cases, when women are stressed, they are able to talk to their fellow women. Or they are able to go to their churches and they talk to their pastors. That is a positive coping mechanism. As opposed to men, most men, before they go and look for a counselor, things have taken long. And many people, especially men, as I've said, they look for the negative coping mechanisms. So if a man is facing stress or they're having this issue of COVID, they end up looking for alcohol to pass time. People who have money, they look for alcohol. Young people who cannot afford to take alcohol, they'll go for the cheap ones. Others, they'll go for banging drugs, illicit drugs like banging, which is cannabis sativa, and things like mogoka. So we have got positive coping mechanisms, and we have negative coping mechanisms. So in addition to COVID, what could be the positive coping mechanisms for this problem?
Exactly.
What we are telling people is that because of the social media, you have to be very careful what you are reading in the social media.
That's true, yeah.
Because there's so much false information which people are getting through with the social media. So the first thing is you look for correct information and you avoid rumors. Okay? So get information from verified sources. And here in Kenya we are lucky because the Ministry of Health is updating us on the status of the illness on a daily basis.
Yeah.
So that is one way of coping with it. The other thing you can do as a positive coping mechanism is that because now you are idle in the house and you are not very busy, there are those issues which you have always ignored. Now you have the time to do them at home. Okay. There are some guys who say that they have not been getting time to do some exercises. And to do some exercises, you don't need to. Your bedroom is enough. There are some exercises you can do inside the house.
Exactly. Yes.
Or you can go to a local place. And because we are avoiding going to the gyms because of the transmission, you can do some exercises in your own home.
Okay.
The other thing you can do is that you can do some courses online.
True.
Yeah. There are some schools which are offering courses online, so you can upgrade your skills now that we have got all the time. Those are positive coping mechanisms. Exercise. People who do exercise, they add days into their lives. When you are idle and you are not able to exercise, so many things go wrong. Your heart, you are not exercising it. The arteries are narrowing, and when you are doing exercises, the blood supply is faster, even to the brain. More exercises means that the blood supply to the brain is higher.
Exactly.
And with a higher blood supply to the brain, it means more oxygen to the brain.
Yeah.
It means more glucose to the brain. So the brain cells are going to recover. They are going to withstand the stressor better than as opposed to somebody who is not exercising. Okay? Also, exercises means that the waste products from the brain and from the other organs in the body, they are removed fast.
Wow.
Okay?
Yeah.
So exercises, if you have not been doing exercises, this is the time to do the exercises. Others, you can try to do some hobbies, those things you have not been doing. I'm sure there are some hobbies we always put aside. And because, for example, one of the hobby I've seen my friends doing is that you can start some gardens in your house. Yeah. Nowadays you need to do some there are so many techniques of growing vegetables in your own smoke compound. That's even on the balcony. Yeah. You just go online and you Google some of those activities and you can do them. So those are positive coping mechanisms.
Yeah.
Negative coping mechanisms. I've mentioned drug abuse. Okay? And I've said in my career right now, even during this COVID era, I'm seeing more and more patients coming to hospital because of drug abuse. Alcohol, smoking banging, chewing mogoka, excessive cigarette smoking. Okay? You cannot solve a stressor by going to those.
Okay.
Actually, you are digging you are putting yourself in a vicious cycle.
Okay.
Yes.
And Daktari, now sorry, let me take you back a little bit. Because all these are as a result of depression, anxieties, and the stressors.
Yes.
Maybe you could mention to us, like, what are some signs? How will I know that I'm actually going through anxiety or depression?
Exactly.
Okay. That's a good question.
Yeah.
How will you know that you are going through a mental health crisis?
Yeah.
Or how will you know that your loved one is going through?
Yes.
Yeah.
So what are the symptoms of mental illness? Because anxiety and other mental diseases, they usually present, there are specific symptoms for specific conditions.
Yeah.
But I'll mention symptoms which cut across most of the mental health issues.
Okay.
Number one, change of behavior. It could be a good sign that somebody is getting sick. Let's take a case whereby somebody has been jovial, they have been communicating, they have been making phone calls to you. Suddenly that person starts withdrawing. There is less communication. There is less talk. That could be a sign of mental illness. Somebody who has been outgoing and now they don't want to leave their home. When you look for them, they are giving you excuses that they don't want to come out. That could be a sign. That is withdrawal. Change of eating habits. Somebody who has been eating well, then they start reducing the amount of food they are eating. Loss of appetite. It could be a pointer that things are not going well. Or even increased appetite. Somebody is eating throughout. It could be a sign of mental illness. Especially in depression or in another condition known as bulimia nervosa. Last week I had a girl, she's in first year university, whose appetite has gone very high. But what the family members are not aware is that she eats, goes to the toilet, and she vomits. So in change of eating habits can point to that. Other very common issues are issues to do with sleep. If you are sleeping for less than 6 hours per day as a grown-up, or you are tossing in bed the whole night, that's a very, very significant symptom of a mental illness. And this lack of sleep is not only for one day, because most of us, we lack sleep for 1 or 2 days. It is persistent, going for 1 week, 2 weeks, and beyond. That could be a point of mental illness. Or even too much sleep. Too little sleep or too much sleep can be a pointer. Others are things, could be physical symptoms like having a headache, persistent headache. And when you go to the doctor is telling you, after doing all the tests, there's nothing, you are okay. But you're still experiencing headache. So headache which has been persistent beyond 1 day or 2 days, going for 1 week, 2 weeks, could be a pointer of mental illness. Other symptoms could be things like fatigue. You're tired all the time. And you're not able to do your activities because you're always feeling tired. Could be a pointer. And others, like the ones who are in colleges and in schools, poor performance and poor concentration could be a pointer. Others which could be serious is when you start hearing people saying that they are hearing voices. There are some people who are hearing. There are some people who can come and tell you they are hearing the voice of God, and because most of us are Christians, we don't want to go deep and check how this guy is communicating with God. But if somebody comes and tells you, I'm hearing the voice of God, and God is giving me these directions, be very careful. Or somebody comes and tells you he's a prophet. Like now I've got 2 prophets in court whom I've admitted into hospital. Okay. Or if somebody comes and tells you he's very suspicious about the neighbor, or they're suspicious about their wives, they're suspecting their wives want to kill them, or the neighbor, he's being followed in the streets, or the DCI, the police, they are looking for them, or Mongiki is after them. Some of this could be true, but they could also be symptoms of mental illness. So symptoms of mental illness are many, and they are large, but those are some of the common symptoms we see, and which can make you suspect that somebody could be having a mental illness.
Wow. Thank you, Dr. So what we are learning today is that we also have to be quite observant, even as we live together. What could be arising out of our homes at the moment and in our families. So it's time for us to get to a short break, and we shall be right back. Please keep watching. Thank you.
Welcome back to Keep Evolving. We're on episode 10. We're here with Jackie and Dr. Gatere. Thank you so much for joining us. We're talking about mental health in relation to the pandemic. And maybe, Daktari, you can just tell us about the mental disorders that are there, and you can probably let us know where we can get help that is affordable and that we can easily access.
Okay.
Thank
you, Wendy.
Karibu.
What are the major mental health disorders which are likely to come out of COVID? The number one mental health disorder is depression. What is depression? Depression, we say somebody has got depression if they are experiencing extremely low mood. That is, they feel sad. Let us use a common word. They are feeling sad. Or somebody has lost interest in these days to enjoy.
Exactly.
Okay.
Yeah.
So some people, not all of them. I've told you that most people, they are going to come out of this unscathed.
Exactly.
But a small percentage who are not able to cope, they are likely to get depression. Other symptoms of depression, other than feeling a low mood or lack of interest, they are likely to feel symptoms of lack of sleep, I've mentioned, having headache, poor concentration, and poor memory. And in extreme cases, they might become suicidal. They might start thinking of suicide, maybe because their businesses have collapsed, maybe because their sources of income have come up, have gone down. So depression, apart from the minor symptoms of depression, we can go to the severe form of depression where some people become suicidal, they can commit suicide. So that is one possible outcome. Another possible outcome is that some people are likely to get anxiety disorders. I've mentioned that anxiety is normal.
Yeah, it is.
But anxiety becomes abnormal if it persists for a long period. And after persisting, it interferes with life. People with anxiety, there are several types of anxieties we treat. There is one we refer to as generalized anxiety disorder. For example, where people are anxious or they are worried. But if you ask them in particular what they are worried about, they are not able to pinpoint. So these people, they will come with that worry, they will come with lack of sleep, they will come with headaches, and they will come with pains here and there. And some of these people with generalized anxiety disorder, they might move from hospital to hospital because maybe they go to the general doctor, they are not able to pick up some of these symptoms. And some of these people, they end up with what we call as Hapanapare syndrome. These are the people who are coming from hospital to hospital. These are the guys with malaria, they are the people with amoebas which are not treated and so forth. So they can have that. Another form of anxiety they might get is what we call as a panic disorder. And in panic disorder is characterized by panic attacks. So you might find somebody who suddenly gets a lot of fear, fear of dying, or fear of having a heart attack. And some of these people will present with pain over the heart. And they will have all the features of panic or of a heart attack. They are breathless, they have difficulties in breathing. And when they go to the hospital, the first thing we do is to call a heart doctor, because even the doctors are not so sure. Could this guy be having a panic disorder, or could this guy be having a panic attack? So there are other anxiety disorders which can crop up, like another anxiety disorder we refer to as post-traumatic stress disorder. But this one is not a very major issue in this COVID era, because for one to have a PTSD or post-traumatic stress disorder, we say you must have experienced a very, very traumatic event. Okay? Like rape or attempted murder, for you to experience some of these symptoms. And because all of us in the world today, we have never experienced a pandemic. The last pandemic we hear was more than 100 years ago, in 1918. So it can arouse some PTSD symptoms in people who have already experienced a traumatic event in the past, but not related to a pandemic. Okay? So some of these people might experience nightmares at night. They'll be having bad dreams. They might start re-experiencing the traumatic events because of the stress they are getting from excessive worry. Some other people, depending on your genes and depending on the circumstances, they can get what we call as the major. They can get what we call as the psychosis. Psychosis in medicine refers to major mental issues whereby one loses contact with reality. And the commonest illness is the one people refer to as mad. I don't want to use the word mad, but there is an illness people refer to as being mad. That one in medicine we normally refer to as schizophrenia. And people with psychotic disorders like schizophrenia, they have lost contact with reality. So some people who are already predisposed to psychotic disorders like schizophrenia or bipolar disorders, they might get a trigger because of COVID. Yes. So they might present with bipolar disorders. They might present with schizophrenia, the way I mentioned. Okay.
Yeah.
Another possible outcome is that because of this idleness, staying at home, and many people are abusing drugs. Some people are now experimenting with banging, especially the ones in high schools and in colleges.
That's true.
5 years down the line from now, or 10 years down the line from now, they present with severe mental health disorders. They present with drug-induced psychosis, especially schizophrenia. Others, they are going to get addicted to the alcohol they are buying from the supermarket that they are consuming at home.
That's true.
Other scenarios, I think you have heard in the newspapers about the teenage pregnancies. And now we are in a crisis because from the statistics we saw in the newspaper the other day, about 4,000 schoolgirls in Machakos getting affected. And it's not only in Machakos, but all over the country. Even today, I had another village in Muranga where 20 girls have been affected in high school. So we are going to experience a boom in young girls who are becoming mothers before their time. So those are some of the challenges which are going to come out of the current crisis.
Wow, so it's quite a challenge for families.
It's so much,
and possibly you're reminding us that we must be very intentional to keep watch over these young people and also over ourselves. A higher level of self-awareness. Because I could be going through some level of anxiety that later translates that I wasn't even aware or conscious. It becomes really serious. Okay. Actually, I have thought about the way, like in high school, we used to say somebody is hysterical. And as you were talking about the panic attacks, I was like, but then what exactly is this whole thing about being hysterical? Like when we see a girl has fainted and we are panicking, and then after maybe, sometimes I would even see someone slap so that they
get up. Exactly.
You know? What would you say about that?
In medicine, we call it, we used to refer to it as mass hysteria. Mass hysteria usually occurs in schools, especially in girls' schools. I don't hear it in boys. It is usually very, very common in girls' schools. Well, it is usually started by somebody who is more, there's those girls, there are those people who are more influential than others. And so it is started by somebody of bearing personality and influence. And then he transmits the symptoms to girl number 2. He might tell girl number 2, I'm having these symptoms, I'm hearing stones being thrown in our hostel, or I'm hearing... And she's able to convince girl number 2. Girl number 2 goes to girl number 3. At the end of the day, now all the girls in school, they start experiencing stones being thrown in their hostels, or they start coughing.
That's true.
And that is what is called mass hysteria. We call it. It has a French name. We call it. A mental illness can be transmitted in quotes, whereby.
In quotes.
It can be transmitted, not the way I can transmit a cold to you. But because my personality is of a bearing over you. And you have low self-esteem over yourself. I might come and tell you, you know what? Even I'm a prophet. I've been appointed by God. I'm supposed to be doing this and this and this. And some of these churches, that is where some of these Spanish churches you are seeing, they are started by people with
big influence.
Some of those delusion, we call them delusional disorders, and they are able to transmit, and that is the way it is transmitted. And the treatment is just, if it is in a school, the easiest way is just to close the school. The girls or the children go back to school, to their mothers. They stay for 1 week or 2 weeks. Those symptoms disappear, and then the schools are reopened.
Wow, that's a good coping mechanism for schools.
That is why you see whenever there is mass hysteria in schools,
the school will close.
We always tell them to close the school. The girls go home, let them stay for 1 week, 2 weeks. After that,
amazing.
You don't give them any medication.
Oh, wow. Simple must help. Maybe before we get to finishing, you can just let us know where we can find help in terms of all these mental disorders we're talking about. Yeah.
Mental health is a stone away from where you are staying, because most hospitals in Kenya, starting with the county hospitals, most of them, they have got mental health workers. And by mental health workers, we have quite a large group of mental health workers, starting with the general doctors and the nurses who are working in those hospitals.
Yeah.
And even more specialized people like the psychiatric nurses. I think all hospitals in Kenya, they have got psychiatric nurses. We have got clinical officers who are trained in mental health. On top of that, you have now most hospitals, level 4, level 5, and level 6. We have got psychiatrists on board.
Okay.
So if you have most of these symptoms, or if you're experiencing any of these symptoms, you can go to any local health center. If you're not able to cope with it, you transfer to the next level. At the national level, the government has set up 2 call centers. We have one at Kenyatta, which was set 2 days ago, whereby you can call toll-free. I don't have the number, but you can call Kenyatta National Hospital, and they'll be able to refer you, wherever part of Kenya you are, whether you're in Turkana, whether you're in Nairobi, whether you're in Mombasa. They'll be able to refer you to somebody who has been trained, who can help you in mental health issues.
Wow.
Even at Mathare Hospital, where I work, we have set up a call center, which is manned by mental health workers, and they can offer you assistance. Yes.
Wow.
Thank you, Daktari. Before we close, would be lovely to hear what would be your parting shot to us and to the audience of the issues of the effect of COVID in relation to mental health.
Well, we are facing an enemy which is not very well understood. As we have said, COVID was discovered the other day, and its behavior is not very well known. We don't know how long it is going to stay with us. The Spanish flu of 1918, which is the nearest epidemic we can refer to, stayed for about 5 years before it was eliminated. The current one, COVID-19, we don't know how long it's going to stay with us. We have seen countries which have done very well getting a resurgence after they reopened. We saw in America how things are going. We have seen in China, which had managed to bring the illness down. We don't know how long it's going to stay with us. The best thing we can do is to follow what the government is advising us to do. We follow what the Ministry of Health is advising us to do, because that is the only way we are going to be able to conquer the pandemic we are facing. But as I've said, we don't know how long it's going to be with us. The best thing is to cope and to do what the government is advising. And we make sure that we don't expose ourselves to any unnecessary risks. Okay.
Amazing. Thank you so much, Daktari, for joining us. Thank you so much as well for watching us. We are very, very grateful. Thank you for staying with us. It's been a wonderful session. We've talked about mental health. We hope that you've picked so much from this discussion that we have had. And we hope that you will apply the coping mechanisms that you've been given, focusing on the positives and not the negatives. Thank you so much for joining us on Keep Evolving, episode 10. Continue liking us, continue sharing this content, continue commenting and letting us know what you want us to talk about. And do not forget to subscribe. Special thanks to ACK St. Peter's, Kahawa Sukari. And we hope to see you in our next episode.
And let's
keep evolving.